Hi, I'm Dr. Robert Gordon, the author of Manipulation Under Anesthesia, Concepts in Theory and Application. In my 23 years of practicing manipulation under anesthesia, I've seen some remarkable things. Manipulation under anesthesia is a procedure that has been around for an enormous number of years. It is not something that is new, and is certainly not something that is experimental. The procedure has been used by orthopedic surgeons and osteopathic professions since the late 30s here in the United States. It was used at one time basically to unlock fixated joints. From a scientific standpoint, what we call that is trying to work with arthrokinetic dysfunction, which are causing fibroblastic proliferative changes. Now, what that basically means is that we are changing and creating new flexibility in joints that have become fixated from adhesion formation. And this usually happens over time as you move forward after an injury occurs. The joints become very locked and very fixated. And one of the problems that we have with that is that we lose function. We lose the ability to move. We lose the ability to rotate, to flex back and forth. When we walk funny, we walk different than we normally would because we can't move properly because of the fixated joints. Now, what's ending up happening is that once that happens, you become what we call anatomically immobilized. You're not able to move properly. Well, conservative care, most of the time, will help you with that situation. Basically, what happens after the fixation starts to occur is that the patient will usually experience pain. And when they experience pain, they're going to go to a practitioner that practices something along the lines of pain management. A chiropractic physician using mobilization, manipulation, and adjustive procedures, possibly an osteopath using mobilization, manipulation, pain doctors, a medical physician who is a pain doctor, maybe doing injection work with you. All of these things put together sometimes don't work. And what ends up happening is the body becomes very stiff and contracted. And when it becomes contracted, what ends up happening is there is no function, there is no movement. The patient's gait will change. Everything changes, everything gets worse. Lifestyle changes. What ends up happening what really ends up happening is the body is shutting down from a neuromusculoskeletal standpoint. It affects many things. We treat fibromyalgia cases quite often with manipulation under anesthesia, and these poor folks have gone through absolute hell on earth trying to get straightened out and to gain back function. It's become somewhat chemical in origin as well because circulation has stopped. These kinds of things. What we're doing now is we're moving the patients into the manipulation under anesthesia arena. Now, what manipulation under anesthesia is really simple. It's providing an anesthesia that allows the body to be in a very relaxed state, but we use monitored anesthesia care today, and what that does is that allows the patient to be in a relaxed state without necessarily losing the ability to breathe on their own. Certainly they're able to tell us where painful ranges are, and we don't lose end range. That's a very significant part of this particular program that we are involved in today with manipulation under anesthesia. Because of the fact that we don't lose end range and we know where pain is, we can take these patients that have had this chronic fixation syndromes through ranges of motion that they have not been able to go through and correct it over a period of usually 3 to 4 days depending on the condition and the patient. The significant part of that is we are gaining back, we are helping that patient gain back movement that they have not been able to have in sometimes months and years.